What epidemiology principles are essential for USMLE Step 3? Imagine you're in a busy clinic, trying to decide if a patient's test results are meaningful or just a coincidence. That's where epidemiology principles come into play. For the United States medical licensing examination, especially the third step, understanding these ideas is vital. They help you interpret data, make decisions, and provide better patient care. About 11 to 13% of the exam focuses on biostatistics and epidemiology, so mastering these concepts can really boost your score. First, you need to understand disease frequency. Incidence tells you how many new cases of a disease happen in a specific population during a certain time. Prevalence shows how many people are living with the disease at a given moment. Mortality rates indicate how many deaths occur due to a condition. Knowing these helps you grasp how common or severe a disease is in different groups. Next, look at measures of association. Relative risk compares the chance of developing a disease between exposed and unexposed groups. Odds ratio is used mainly in case control studies to estimate how strongly an exposure is linked to a disease. Absolute risk reduction shows how much a treatment decreases the risk of an adverse event, and the number needed to treat tells you how many patients need a treatment to prevent one additional bad outcome. Diagnostic test evaluation is also key. Sensitivity measures how well a test identifies those with the disease. Specificity shows how accurately it rules out those without the disease. Positive predictive value indicates the likelihood that a positive test means the patient truly has the disease, while negative predictive value tells you how confident you can be with a negative result. Study designs are another important area. Observational studies include cohort studies, where you follow groups over time, and case control studies, which compare exposures in people with and without the disease. Experimental studies are mainly randomized controlled trials, where patients are randomly assigned to different treatments to see what works best. Bias and confounding can throw off your results. Selection bias occurs when the study population isn't representative. Information bias happens if data collection is flawed. Confounding is when a third factor influences both the exposure and the outcome, making it look like there's a relationship when there isn't. Recognizing these helps you interpret data correctly. Finally, understanding basic statistics like averages, variability, confidence intervals, and p-values is essential. These tools help you judge whether the results of a study are meaningful or just due to chance. Applying all these principles during clinical practice means you can better interpret screening results, weigh treatment options, and make evidence-based decisions. On the exam, you'll see questions embedded in clinical vignettes. These questions might ask you to interpret disease rates, test accuracy, or study results. Being comfortable with these concepts allows you to answer quickly and accurately. Remember, knowing how to interpret data and understand study designs is not just for the test. It's a skill you'll use every day as a practicing physician. So focus on these core epidemiology principles, and they'll serve you well both on the exam and in real patient care.